The impact of diet and lifestyle in your eye health can be tremendous. Nutrition is very important for your eye health. The closer you can get to a plant-based diet, the better off you are. We look at the condition of the blood vessels in the back of the eyes. And your fruits and your vegetables, things that are brightly colored, are the types of proteins that the back of the eye really needs. These are things that affect your color vision, overall health, your circulation. So as some physicians have said, and other experts in nutrition, food is oftentimes your best medicine. And this also translates to your eye health. Things like diabetes are inflammatory conditions. So you want to eat an anti-inflammatory diet. So that's where your brightly colored green leafy vegetables, things like wild-caught fish, can be very helpful in decreasing the inflammation in the body. Sometimes you have to take supplements if you don't have a good diet, but always move the needle more towards your diet because, again, it affects your overall health. A lot of times people with a poor diet can still have a dry eye. So that's why an anti-inflammatory, the Mediterranean type diet can be very helpful in managing your eye health. Day-to-day habits that are very important is just movement. Sometimes we talk about exercise, but when you move, that can be walking, could be line dancing, can be chair exercises if you sit and watch TV for many hours, or if you're working at a computer, but you want to get your heart beating, you want to improve the circulation in your overall body, you want to improve the circulation in the back of the eyes. It is said that sitting at your desk is the new smoking. So sitting a long time at your desk can be just as detrimental to your circulation as smoking has been. So we move more in the day, walk a little farther, but be consistent. People are often concerned about being on the computer for so many hours, and we hear blue light filters. Well, blue light is controversial in terms of it affecting the health of the eyes, because your eyes have their own natural blue light filters, but blue light filters have been shown scientifically to affect your sleep cycle. Talk to your children, try to get them off the computer, the cell phones, the tablets, 2 hours before bedtime. And guess what? That goes for us as adults, because sometimes I find myself on the computer late, and then I almost have an insomnia attack where I can't go to sleep too early. So try to get off your digital devices at least a couple hours before bedtime. Sometimes you also need to apply lubricating drops or refreshing sprays in the eye to help replenish the moisture in the back of the eyes. Because when you're staring at the computer, you get more evaporation of your tear film into the air, and the eyes become more and more dry. And we're seeing this a lot more in kids when we used to not see it until they were adults or senior citizens. So all of the different generations are showing more dry eye because of more digital screen time. To reduce computer eye strain, there are specially designed computer glasses that we prescribe quite often to help make that computer screen pop, gives you a wider reading area, and you don't see too many advertisements for these computer lenses. You can walk around your office, but they're not designed for long distance vision and driving. So yes, you may need more than one pair of glasses, more than one lens design if you do a lot of online computer work. Choosing the proper eyewear is so very important. And that's where a trained optometrist or an optician can help guide you to glasses that are going to function well. So the glasses are an appliance that actually holds your prescription lenses in a way that you're going to see most comfortably. And nowadays, there's so many different avenues to get prescription glasses, from online to in-person ways of selecting eyewear. So one thing I want to make you aware of is that simply having a PD is not generally good enough for various lens designs that you may need to wear. So when you're properly fitted with your glasses, they not only look at, does the frame fit? Now you might see something that you like, fashion-wise it's great, but does it fit you properly? Does it fit your prescription properly, where it's aesthetically very pleasing, but where you also can see very comfortably? There are some unique things about African Americans that we look for in our frame selection. African Americans typically need a little bit longer temple, and our bridges tend to be wider. So not only African American community, but the Asian community and Hispanic community, we tend to need a little bit wider bridges. So it's very important that the frame fits so it's not constantly sliding down. We also check to see if you're on a computer, is it in a position to where you're gonna wear it. So we tell people when they put on their frames, put it in a place where it's comfortable so we can place your prescription properly within that frame. It's hard to do that, almost impossible to do that online. So that personal care is so very, very important, especially with us. And we also feature some African-American owned frame lines and designer lines, because guess what? We know what's important in terms of style and how our frames are gonna fit our faces a little bit better.